Eric Durek, and welcome to this edition of Medhealthfit, the TV show that integrates wellness and healthcare. And this is the second part of our series in our interview with Dr. Craig Brandman, the CEO of Step One Health in Palo Alto, California. Craig is a former practicing cardiologist, and I think that you were at UCLA for a number of years, correct?
I was. That's where I got
And then
trained.
you moved up to Palo Alto, and now you are the CEO of a high-tech healthcare company called Step One Health, which is basically a lifestyle medicine company, and it takes the information from both your blood panels and your genomic profile and allows you to sort of move forward in terms of a better self-care, self-health management program. Am I correct?
Exactly.
Okay. So in our first episode, we spoke a lot about your business and elements of the blood labs and sort of what this process is, this changing landscape of the whole blood panel and how it relates to medicine. And I wanted to start out this episode with a very interesting article that I read recently in Fortune magazine about a blood lab company also from the Bay Area. And as I was reading this article, I said, well, it sounds a little bit like Craig's company and some of the things that he wants to do, except for the fact that this was just a lab company and yours is a little bit more than that. But I think what struck me the most was that this company had a very high financial value, and which told me that Wall Street and investors are really becoming interested in this element of medicine and self-care, lifestyle, whatever we want to call it. The money people are interested. Am I correct?
I think you are. We have raised some money as we've basically gone into the development of our company, and we've had the opportunity to talk to people about where we think our value proposition is and what our market is, and we've been blessed with a lot of very positive responses. And I think what people are realizing is that, increasingly with access to information, the things that you talked about in terms of establishing your baselines, knowing your genetic profile, and understanding what your options are, as people basically get more involved in that and improve their outcomes, that's just going to continue to build on itself. People talk to one another about what's working in their lives. They talk with their coworkers, they talk with their friends, they talk with their families. Health comes up a lot. As people begin to enjoy, maintaining their wellness and improving the quality of their life, they feel better, they may look better. That just sort of is something that other people want to include in their life. And so it sort of becomes a very, if you will, in the 21st century terms, it becomes very viral.
Well, I don't want to hum and haw on this issue too much. Because a lot of people say, well, there's a lot of really bad information on the internet. But I also tell them there's an awful lot of good information. And I'm always quick to remind people. I said, I was involved with medical research back in the day when I had to go to the medical library and I had to find a reference in a journal somewhere on a shelf in the back of a very large room. I would go Xerox that one article. Today, I can plug in a topic and I can find that same article. It might be an abstract, but I can find that same article on the internet and 25 others just like it in the blink of an eye. So my access to information in 30 minutes now in 2014 must be 50 times faster than it was when I was a full-time researcher with access to the library in any journal that I wanted to make a Xerox. One time I had like 7,000 or 8,000 Xerox journals in my library, and nowadays I don't even need that. I can look at all this stuff online. So our access to information, and your company's part of that because you're using this information on your website, and correct me if I'm wrong, you actually also have access to health coaching and online assistance, real live people to talk with as well, correct?
Exactly. Our thinking about how people are going to evolve their interaction with the healthcare delivery system is that they don't necessarily need to only rely upon their doctor. Their doctor's a part of it, and there are certainly many instances where their doctor is going to be an important part of understanding what's going on with them, and so we collaborate with the relationship that consumers have with a doctor that they trust and that they have confidence in. But there are other areas of health information and choices where there are other team members in the healthcare delivery system who may know more about a particular area than the doctor. I mean, nutritionists are a very key part of helping people understand where they can make changes in their lifestyles that are important, and there may be a much more informative interaction that consumer can have with the nutritionist than they might have with their doctor. And doctors are trained to focus on disease and mitigation of disease-related episodes, but they may not be as well informed about choices about diet and nutrition and supplements, is one of the things that you and I have talked about, than the nutritionist or the pharmacist. There are areas of exercise and activity where a trainer may be somebody that can have a good conversation with a consumer. There may be things that they can do to understand whether somebody is really ready to get into a very vigorous exercise program, whether they may want to approach that in a slower way if they're maybe a little bit older and maybe have had some issues, or maybe they haven't been that active in their life, right, and they need to start. So they may not want to just go right out and start running marathons. They may want to ease into that, because right, otherwise they're going to get injured, and that's going to be that'll slow things down.
Right. Well, we spoke before the show about the element of where the physician kind of fits into this new paradigm, and I mentioned like the quarterback is that they could throw a ball to the receiver or hand off to the fullback or run the ball themselves, whereas the doctor now, they have a lot of choices. That they have a nutritionist, dietitian, they have an exercise trainer, physiologist, they have a health coach, which is a different type of job. You have a pharmacist, you have a counselor, you have a nurse educator, you've got a diabetes specialist, a cancer specialist, a so-and-so specialist, that all these people have these tremendous skills, and the doctor may weave them into one of those skill sets. And that brought up another conversation about the doctor of the future who may be a partner in a health club chain, or may be the director of not just hospital rounds or having their own private practice, but they also may be involved with a wellness clinic. And they may have bits, and instead of worrying about losing their practice to someone like you, to your company, they may want to get involved in something like your company, where they're involved with you as a sort of a wholesale retail or something of that nature, or they may want to get involved with something like a health club chain. And that leads me into my next question, is that part of the success of your company is not only going to rely on the traditional healthcare brick and mortar, this clinic over here, this hospital over here, this doctor's practice down the street, but you're really interested in working with the health club networks, the wellness care networks, et cetera. And I mentioned that before the show, 2,100 oncology centers in the United States, 31,000 health clubs, and growing.
Right.
I mean, not that all of your patients are going to go out and do CrossFit, but I was astounded in my 25 years in the health business, and I've spoken at the IRSA conference for many years, and I think when I started there were about 18,000 or 20,000 health clubs. Now there's over 30,000, and I'm not even sure that they're counting the Pilates centers or the CrossFit centers, or we have here in Santa Barbara a number of these sports conditioning centers that are just studios. So the studio concept as well. We're looking at the Spectrum clubs, the Gold's gyms, the health fitness corporations, et cetera. Mm-hmm. These sort of big, well-known health clubs, as opposed to all of the other options now that people have. Now, I drove on Upper State Street on my way down to the studio today, and I saw Pilates Center, which is owned by a friend of mine. And in the past 3 years, she bought the business next to her, and now her business has twice the square footage. So she has not only her Pilates and her all of the mat work and all the stuff she does, she now has spinning classes and other types of things that she does. So she's branching out her sphere of influence on the upper, the San Roque area here in Santa Barbara. It's growing, growing, growing. And I've always heard that the health and fitness profession is almost recession-proof. And I've seen it go through two pretty big, economic downturns in the past 25 years, and they've pretty much come out pretty well. So you're interested in doing business with these people because you feel that that's the wellness component of what Step One Health is kind of all about, right?
I think that that's right. It's an interesting thing, but historically, the traditional healthcare delivery system has been very exclusionary in terms of dealing in a collaborative way with the health and fitness industry. And when you think about it, if you really are a believer, which I think many of us are, and increasingly so, that exercise is medicine and it's a way to maintain and improve your wellness and your health, then it is a natural collaborative opportunity for the healthcare delivery system to work in a very sort of integrated way with the health and fitness folks, because not everybody, it's not a one-size-fits-all kind of situation. There are some ways that you can actually tailor, exercise programs to fit the specific needs of different individuals, and that collaborating there, and again, going back to what we talked about in our earlier segment, knowing your numbers, knowing your baselines, looking at your trends, and basically evolving these things really gives people a very significant opportunity to bring these resources to really optimizing their wellness and their health.
Well, let me take a specific example. In the health club profession, there's a national program called PACE. People with Arthritis Can Exercise, PACE. I would see a collaboration with your company that a person with arthritis, a rheumatoid person, is in doing the water exercise twice a week. They're maybe in the therapy pool and they're doing their exercise and therapy type stuff. But we're using Step One Health laboratory values to see if indeed that exercise program is actually making a change in their inflammatory process or any of their other markers that may be making their condition worse. So the exercise is improving that, but the only way they're going to know, other than the fact that they say they feel better, is through some regular blood work, correct?
I think that's exactly right. In fact, we, as part of the development of our business, have a very significant part of what we do in terms of collaborating with the fitness industry, because we believe that people, see if they are a member of a fitness club, that is an important part of where they spend their time, and basically they can have relationships with their fitness instructors or their coaches, which is a trusting, collaborative relationship. And by basically enabling those people to basically have access, again, with the permission of the consumer or the patient, to have access to some of these numbers, they can then begin to really in a very personal, individualized way, work to address these issues. And again, in going back to the whole concept of a trend line, really getting the trend line to go in the direction that everybody feels is going to basically optimize their health. So really what you're doing is you're just expanding the team, if you will, of those individuals that can basically be part of really getting the outcomes that everybody believes are going to be the most desirable.
Do you see the supplement industry as becoming more of an integral part? And I'm gonna preface this by saying that recently Dr. Oz, famous doctor, I actually have never seen his television show, I've seen snippets, but he was recently called before Congress because he made some claims on his television show about these miracle weight loss supplements from 2 or 3 different companies. It wasn't just one company, it was sort of a handful of them. And he got up there and he kind of got his hand slapped by these congressmen. But during the same tenure, a very famous epidemiologist from medical school, Dr. Walter Willett, who's published the Physician's Health Study, the Nurse's Health Study. He's published many, many articles on lifestyle. And he himself is a board of directors for the Center of Integrative Nutrition, which is a national education company. And he wrote an article in the Annals of Internal Medicine here recently, a letter to the editor saying enough is enough. There's enough research on nutrition and supplements that they're very safe, they're very effective, and we're actually moving in specific directions like this national epidemic of vitamin D deficiency. And that they're saying that vitamin D, which, by the way, I've read is the only vitamin that is cleared by the FDA that can treat or cure a disease. That's the only vitamin or mineral that the FDA has actually said can do that. So Dr. Willett makes a good point. But in coming back to my question to you is that as part of what you do, I mean, your genomics is great for the drug interaction, but do you also see where you're going to steer them again into this area where maybe they do need to be taking certain supplements or dietary something in order to achieve this more optimal health status? Is that part of the game plan?
It's a big part of our game plan, and I think that you touched on a number of things that we think are very important. So we think that the whole concept of taking vitamins and supplements, depending upon what your personal issues are, is an important choice. We think that the ability to understand the implications of that, and if you are on a medication or if you are taking multiple supplements, the ability to understand how all of these things that you're putting in your body interact with each other is an important thing, and that information is something that we are able to provide the people that see us as a resource. We've got a pharmacist that we work with who is very knowledgeable in that area, and we can provide people with information about that. Because drug interactions or chemical interactions, you need to understand them. And having a sense of comfort that if you're taking 3 or 4 things, that they're not either inhibiting one another,
right,
or potentially causing an interaction which may not really be optimizing what your goal was, is an important thing.
Well, vitamins are chemicals. Minerals are chemicals per se because they elicit a chemical reaction in the body. I mean, most people don't understand when they crack open their can of Coca-Cola that the amount of sugar in there acts as a chemical in the body. It raises blood sugar, it changes your insulin, it changes other types of hormones. So I look at this, if it elicits a chemical reaction, even though you might think it's a, quote, natural product. And I think that what most people look at with supplements is that, well, they're natural, drugs are not. Well, there's a lot of synthetic vitamins that are out on the market, which, by the way, Dr. Willett and others have said that, if you're testing synthetic vitamins, you might not get the results as you would with other natural type sources. That's a little bit beyond the scope of what I want to talk about today, but what I see with Step 1 Health is that if a person has a vitamin D deficiency, they'll be able to see that with your blood panel and you'll be able to follow them over time. And I see that as the real beauty of what you guys do is that most doctors, not most doctors, let me rephrase that. Some doctors will poo-poo the vitamins and they'll say, well, it's more important that someone is on this prescription. Mm-hmm. Whereas you can look at the whole interaction, everything. I'm going to call it the whole kit and caboodle. The food, the vitamin supplements, and the medication interaction, and not just the meds with the meds, but the meds with everything else, because you can look at that whole range of panels that person is now getting with you at a great cost, something that they can understand. I'm sure that you have the ranges and the simple things one of the things that I did with a blood panel once, I had 158 blood components. The guy gave me a binder. Mm-hmm. I said, was this my doctoral dissertation? What am I going to read all this stuff? And he went through page by page. It took him 25 minutes. He did a great job. But this was more of a concierge medicine clinic that I was at. Most doctors don't have the time. And again, I'm going to come back to why I believe Step 1 Health is important, is because you have the time. If I have a question, I can call your coach and say, I don't really understand this.
Exactly.
So I'm going to come back again. The supplements, the food, the drug interactions are all part of this thing. And you guys are sort of making it user-friendly and you're moving forward. So I was going to ask about vitamins and regulation. It looks like, you know, in terms of the lifestyle management, I'm going to go with, in the last few minutes that we have, I want to go with the whole concept of lifestyle medicine and the future of where we are headed. I remember in 1991, Dr. Woolhandler from Harvard University wrote The Medical Economics, and how she really felt that at the time that medical costs were 11.8 of GDP, and she thought, oh my God, if they go any higher than that, our economic system's going to collapse. Well, I heard one of these famous guys at a healthcare meeting a few years ago say, we're at 17.5% of GDP, and if healthcare costs get any higher than that, oh, we're going to fall off the cliff. Well, we're like at 18.5, 19% now, and I don't. So it's creeping, it's creeping, it's creeping. We've talked about in the last segment cost management and the economics of doing what you're doing. It's online, you're saving time, you're saving money, you're saving travel, you're saving time off of work. I understand that economic benefit. But lifestyle medicine, now here in Santa Barbara, of which you will be a resident here very soon, congratulations on that, we spent 5 or 6 years ago hundreds of millions of dollars to renovate Cottage Hospital. It's beautiful. I mean, it could be part of the Bacara. It's wonderful. I mean, the just going in there, it's just a very pleasant place to be. But with all of the work that they did on infrastructure, the question begs itself, is that have they improved the quality of the medical care? And now Sansom Clinic is building in a Medicenter and an eye care institute on North Foothill, which they're spending a lot of money, whole new building. But it begs the question, how will it bear with the quality of the medical care? It might be a great new building, but we want to make sure that the patients are still getting a good product at what we consider a reasonable price. And I certainly know people and have worked at Sansom and understand that they do great work, but it's infrastructure, it's brick and mortar, it's expense, it's the building process. You're online. You don't have those issues. Is this lifestyle management of the future, how much of this is going to be both internet, interactive, and not in a building? How much of that's going to be in the privacy of your own home?
I think it's going to continue to increase. There will always be a place for high quality brick and mortar institutions in the delivery of care, because there are pieces of equipment that you need to access that obviously can be housed in these facilities. There are procedures that need to be done in these environments because of the need to basically have sterile, safe and well-maintained kinds of things. And there are health issues, there are medical issues that come up where if something's going on, you're going to need to be watched, around the clock by skilled providers. And for those kinds of issues, it's important to be in a facility where, all of those things can be maintained at the highest level of quality. But what we know is that increasingly we're learning that there are things that we can do that don't require us to be in those facilities, and hopefully, if we do a good job of understanding what our options are and being compliant with the choices that we make, we can maybe allow ourselves to avoid having to be in one of those facilities. That's really ultimately the goal.
Do you consider yourself and your company to be concierge medicine, or are you going to be concierge medicine for the masses?
Well,
it's kind of a loaded question, I know, but concierge in the fact that you offer a pretty valuable service. But is this something that someone who might be a Medicare patient would be able to utilize?
Absolutely, and I would say that the answer to the concierge question falls into a number of different categories for us. So we certainly, if you think of the term concierge, it's really providing people with answers that are specific to them.
Okay.
It's not just sort of if you want to go out and have an Italian meal, here's a list of 5 Italian restaurants. If you're looking for a particular dish, there may be one restaurant that does a particularly good job, and somebody that knows about what the choices are can say, okay, well, if you're looking for this, this is the place for you. If you're looking for that, maybe you want to consider going someplace else.
Right.
So we fall into that category. But we also collaborate with physicians because we can help them really optimize how they interact with their patients, because not everybody needs to see a doctor. We talked about that earlier. You know, it gets into this team approach, and it then really is the opportunity for the doctor as a concierge to basically be interacting with the people that trust them and that look to them to help them with their issues in a way in which is most personally and professionally satisfactory and for them. So they're not necessarily seeing somebody that has a problem that they need answers to, but it's a pretty simple problem, and they can really see somebody else on the team to get that information. They're going to be dealing with people who, as a doctor, you know, may have complex problems. There may be a number of things that are interacting with each other that, you know, the additional education and training that doctors get make them better qualified to help work through those issues, whereas that there are other members of the team that can basically help people deal with, you know, maybe more straightforward and less complicated issues. And it sort of then becomes really the ability to sort of really get the fit that is best for that particular circumstance.
Okay, last question. Where do you see Step One Health in the next 5 years? Do you guys see yourself as being a major player in the lifestyle management / home medical care market? Is this, do you see yourself being on the cover of Fortune magazine?
Well, hopefully, yes. That's our goal. We want to continue to be a player in what we think is an important part of how people interact with understanding what their opportunities are and what their choices are. What I tell people is that, Step One Health will evolve over the next 5 years. We expect to be a major player. That's certainly our goal, and we're trying very hard. And I have the benefit of working with a very talented team of people that are going to help us, position ourselves in that way. And we are really looking to be a highly integrative and comprehensive destination for people to basically understand what their personal issues are and understand what those choices are that are going to basically best help them deal with whatever is in front of them. So integrated and comprehensive, and the value that we have is that the internet and our technology will allow us to continue to grow and to add these things. And we really actually spend a fair amount of our time listening to the people that have found us to be a good resource, because they'll say, hey, you introduced us to this, and what about this? I learned about this. I talked to my friend, and they gave me some information about something, and I didn't see that you guys knew very much about it. So we've got people that basically give us information about things that we go out and we learn about, and if we get comfortable that these are resources for people that see us as part of their solution process, we add them to what we provide people. So
Excellent.
It's really a very interactive process.
Okay. The website is steponehealth.com. And Dr. Craig Brandman, our second session, fantastic information. The future of healthcare is right here. Appreciate you having us on the show. Eric Durack for Medhealthfit.com. We'll see you next time.